Welcome back, Science Tailors, to Decoding Long COVID, Dexamethasone, and Beyond. I'm Dr. Shikha Agrawal, your guide stitching together the fabric of this condition. After chasing viral ghosts last time, I'm thrilled to craft a bespoke approach to dexamethasone treatment in today's episode on personalizing dexamethasone with bioinformatics. As someone who has tailored the molecular patterns of Leishmania helicases, I'm fascinated by how bioinformatics can customize care for long COVID. Prachi Virat is here, our microbiology seamstress with a passion for microbiome and bioinformatics, ready to weave some insights. Prachi, long COVID's complexity demands precision, like designing a custom suit. How does bioinformatics tailor dexamethasone treatment for individual patients?
Perfect analogy, Dr. Shikha. Bioinformatics is our tailor's toolkit, using data to fit dexamethasones to each patient's needs. Metagenomic sequencing mapped the microbiome, revealing dysbiosis pattern linked to long COVID symptoms. A 2024 Nature Communication study found patients with low Faecalibacterium level had a 40% worse response to dexamethasone due to reduced anti-inflammatory SCFAS. Machine learning model analyzes these microbial profile alongside immune markers like IL-6, predicting treatment outcomes. For instance, a 2023 bioinformatics studies model could identify patients likely to benefit from lower dose dexamethasone, 2 to 4 milligrams, with 85% accuracy. This reduces side effects like infection, which affect 20% chronic users per a 2024 clinical infectious disease report. This precision ensures we are not just cutting fabric blindly, but crafting a perfect fit.
That's like stitching a suit with surgical precision. How does the microbiome specifically guide this personalization, and what role does bioinformatics play in optimizing it?
Love the stitching metaphor, Dr. Shikha. Well, the microbiome's like a fabric texture, unique to each patient. In long COVID dysbiosis, like depleting bifidobacterium, worsen inflammation, impacting dexamethasone efficacy. A 2024 gut microbe study showed patients with higher Clostridium levels had a 35% better symptoms relief with dexamethasone due to enhanced SCFA production. Bioinformatics weave this together. 16S rRNA sequencing identify microbial signatures and metabolomic track SCFA levels, guiding probiotic or prebiotic add-ons. A 2023 Frontier in Microbiology study used random forest models to stratify patients, recommending probiotics for those with lower SCFA producers, improving outcome in 60% of cases. This data driven approach minimizes microbiome disruption from dexamethasone, ensuring a tailored treatment that fits like a glove.
Prachi, you have crafted a masterpiece today. Let's hem these insights like final stitches on a custom map. You have shown bioinformatics as a tailor using metagenomics and machine learning to fit dexamethasone to long COVID patients, with that 85% prediction accuracy being a perfect cut. The microbiome's unique weave shapes the design, and probiotics are our thread. Prachi, what's your key takeaway?
That tailor's metaphor is such a spot on, Dr. Shikha. Bioinformatics teaches personalized care, ensuring dexamethasone fits each patient's long COVID profile. The microbiomes are our fabric and data is our needles, crafting precision treatments. We are designers in this health atelier, sewing hope with science.
Prachi, thanks a lot for shedding light on this topic. Dear listeners, thank you for being with us. If you like the episode, hit subscribe, share this episode, and join us on social media with our hashtags. Let's keep tailoring long COVID solutions.